Hello everyone, welcome to 2050 Healthcare. Today we have Dr. Mitalee, Senior Consultant, Neurology, Care Group of Hospitals with us. Welcome ma'am.
Thank you, Lekha.
Today we will be discussing about brain plasticity with ma'am. Ma'am, we would like to know what exactly is brain plasticity?
Neural plasticity, brain plasticity is a very recent concept. In last one decade, it has become a very upcoming thing. But I would like to also give you some insights that in our Vedas and in Purans and even in Gita, like in 3.33 words of Gita, there is a mention about this term was not there, but they have mentioned that one's own self is the most one's own mind is the most powerful thing. The meaning of that is and you can be your own enemy, and you can be your own motivator, and you can be your own friend and enemy both. And you can also develop your own inner capabilities, and you can expand your mind. This was the meaning of those verses, which is pointing towards like neural plasticity. It was known to the human mankind since like ages, but a lot of research and has been happening in last over like 50 years, and now it is taken up a bigger form. And it refers basically to the brain's adaptability to various circumstances, and it also refers to the constant rewiring that our brains are going through.
Ma'am, can brain actually repair itself after damage?
Yes, the answer is yes. And it does it through the neural plasticity, because there are various mechanisms inside the brain. Because if we have to understand it little deeply, we must understand that the brain cells are called neurons. So there are millions of neurons inside the brain. And whenever these neurons have to talk to each other, they will have that neural talk with the help of electrical signals, with the help of the chemical exchange in between them. And this happens at a point, at a connection, which is where two neurons get connected, and that place is called synapse. So there are billions of neurons, as I told you, and there are trillions of synapses. So
Okay.
you understand, constantly the brain cells are talking to each other and firing, and this exchange of information is happening. And in during that exchange of information, brain is constantly, every second, every nanosecond rather, brain is getting the information about the inside of the body and outside of the body constantly, so that it can protect the person, and the body stays protected. So whenever this kind of functioning is happening, this functioning, if it gets destroyed due to, like you were saying, like due to stroke or traumatic brain injury, then what happens, that particular area of function gets lost.
Okay.
Okay, so if that function has got lost, there is it's a god, we are God's creation. There is a remarkable capacity of the brain that another area which was not that functionally active can actually take up the function of this part of damage.
Okay. Like, ma'am, is brain plasticity stronger in case of children than in adults?
Yeah, yeah, true. That is, if you have to understand that in child, when as a child is born, so many sensory systems get activated.
Mhm.
It gets a sensory input from your immediately from your mother, family, outside world, and they start learning. The brain that time physically also the brain is growing in size. Also, the body is growing. The brain size is also growing,
Okay.
and actual neural growth is happening in physical form also, and that is the highest time when you can learn. And it usually gets plateaued once you reach a certain age, especially around 20-25, that gets plateaued. But that doesn't mean that brain cannot rewire, cannot reinvent later in the life. You can learn new skills later, though
Mhm.
it gets little lesser as compared to your childhood or adolescence phase.
So that's the basic reason we say that children adapt to things very
Yes,
easily,
yes, yes.
right?
Yeah.
Okay, ma'am, is it true that brain can learn new ways to do the same work?
Yes, true. That is a mechanism through which the area, suppose like in people who are suppose blind, their auditory stimulation. You must have seen that
Yeah.
they are very easily, they'll thoda sa आवाज which
Yeah,
we
yeah.
miss,
The
they will
receptive skills are good. Yeah.
catch it. The visual cortex is not seeing anything, but it has been seen that the visual cortex now takes up auditory functions also. This has been documented and came in research papers also. Then, since one sense organ is down, the visual cortex, the area in the occipital lobe, can also take up the auditory functions. So they are very sensitive. Somebody is passing by, even if they are doing very stealthily, they are going. And you must have seen that in that movie was there, Aankhein,
Yeah, right.
right? No, yeah. In that movie also, that is so nicely they have shown that visually blind people have done remarkable through training and practice. So yes, the answer to your question.
So, ma'am, basically after stroke or brain surgery, like how exactly does the brain start recovering?
Yeah. So there are a few mechanisms given in the literature. Like there is, what happens is homologous area adaptation happens. And in that, what I was just describing, the area starts, the brain area starts adapting the new functions. Suppose the damaged area is there, and before that, I think we must understand these things will only happen provided they start practicing the previous skill, the
Okay.
whatever skill was lost. Suppose they lost their power to the hand, so if they start practicing that area of that skill again, then what will happen, the area near to that area starts gradually the neurons start firing and having the crosstalk, and they can have adaptation of that area can happen. So for that, practice is required. It's not that just sitting idle, that will automatically start happening. So practice will be required for that.
Okay. Ma'am, can we deduce from this that the damaged part of the brain basically is taken over by the other part?
Yes, yes, there is map expansion, cross model alignment also happens, and
Okay.
these type of mechanisms will help brain to adapt uh, as you practice, as you grow the new skill, or the even the older skill which was lost by that person due to the unfortunate incident,
Okay.
whatever happened.
So, ma'am, like, can we assume from this that the person,
Hmm.
whoever has met through this kind of an injury, can the patients learn to walk or talk, or rather the other skills also? Will they be similar exactly like the way they used to be before?
See, it all depends on various factors. Like we discussed, ki stroke or any other disease depends on various factors.
Right.
Recovery also depends on various factors.
Mm-hmm.
How well the disease part, acute illness was taken care of, and how well the rehabilitation process was taken care of. So all the recovery is closely linked to your how well it was taken care of. Whether if the person is simultaneously suppose diabetic or and had a stroke, so that person's sugar level will affect his stroke recovery. That has to be understood. Only suppose the person is having the best of rehab care and physiotherapy, everything, but his sugars are uncontrolled, the recovery
Right.
will not be that optimum. So for that's why we should aim at a holistically, the person's whole system is getting checked up and is getting adequate therapies in holistically for physical therapy and emotional part also, and the other medical issues if the person is having, for example, diabetes, hypertension, everything has to be taken.
Ma'am, as you were mentioning, that we need to put it into practice,
Hmm.
right? Like if the
Hmm.
hand is not functioning, we have to practice and make it work
Hmm.
like it was doing before, right?
Yeah.
So, which means this practice is a part of a physiotherapy regime,
Hmm.
right?
Hmm. Hmm.
So, how does physiotherapy help this kind of, like in brain plasticity, basically?
So, physiotherapy and neural plasticity are like hand and gloves. They are
Okay.
so close knit.
Okay.
Okay, so for this understanding, when we say brain plasticity, neural plasticity, they sound like some alien, मैंने बहुत दूर की बातें हैं, ये सब हम लोग कैसे करेंगे? So for understanding of general person, I would like to say that give you example. Like suppose you are sending your son to a music teacher. If he is not able to play the piano well, what will you say? Or the music teacher will say? What will they say?
Like basically, he's not
Suppose he
adapting to the skills, or
so
maybe.
for a note or something you have given that task and he's not able to perform it well, then what will you first suggest?
So he or she has to, you know, give more inputs into it,
Yeah, like practice.
practice it.
Exactly.
Yes,
So though
exactly.
it comes down to practice, even if you are like not able to do calculations, what we say, ବସିକି ମ୍ୟାଥ୍ କରୁନୁ ହେବ ଭଲ ହେବ, that's a usual
Yes,
household thing. The neural plasticity is in the house. If you are not able to make a roti goal, what we our mothers will say,
we do practice it. Yes,
practice.
yes,
And so
exactly.
exactly that is there in our households. Now it is this term has come, so we are getting scared or something. It's something very out of scope thing. It's not like that. We have learned new skills by that only, because it's basically brain is forming new synapses, making new networks where they are learning the new skills and programming it. Again, if you have some issue or injury or any trauma, be it physical or emotional, the rewiring can always happen. And the best part is this rewiring happens lifelong.
Okay,
This is the
right.
good news, isn't it? So, if the rewiring can happen lifelong, why not that your question gets answered there? That why not that person will improve? But what is required is what I said, holistic, realistic approach where physical therapy is a definite important thing, because there are a lot of rehabilitation programs are using this neural plasticity of property of the human brain with the help of various therapies. One of them is music therapy. Why? Because whenever you hear a music therapy, your whole of the brain cortex gets stimulated, auditory, your visual cortex, your memory gets stimulated. So all the brain areas or language area, every area gets stimulated. So music therapy is included in most rehab programs. I think you people also
Yeah,
doing
right.
that very
Yes,
nicely.
yes, ma'am.
So apart from that, there is mirror therapy, which also works on this principle. And nowadays, transmagnetic stimulation they are doing to enhance the brain neural networking. Also, they are doing constraint-induced movement therapies. They are using for rehab programs. You people also planning about robotics and exoskeleton-based physiotherapy programs. So
Right.
these are all based on uh, neural plasticity and brain plasticity. They function on that principle only. These are the different modalities of using therapies, but they function on the same principle. So this is the latest thing which was there with us. We are recognizing it with a new name, and has to be used in full potential. Human brain is just has endless capacity, and it stays lifelong, but we have
We
to
just have to make
harness
it
it.
work.
Yeah, we have.
So, ma'am, like it is basically a restart revision
Yes,
cycle, right?
yes. Restart, revision, rewire, and relearn, reinvent yourself.
So, ma'am, if this entire thing we are putting it in a nutshell, then how soon a rehabilitation for should start so that this entire process will accelerate?
I believe the next day. You suffered a stroke, acute therapy has been done.
Mm-hmm.
Rehabilitation should be part of the second day for stroke, especially.
Okay.
And for a traumatic brain injury, suppose it's like a multi trauma case or something, then after stabilization, once the patient is out of danger,
Mm-hmm.
immediately rehabilitation should be included, because it includes not only physical, it includes pulmonary rehabilitation, cardiac rehabilitation as well. So it should be a part and parcel of regular practice, I believe. Whenever there is involvement of a brain or spinal cord, I believe this should be a part and parcel. We cannot exclude it by any chance, if at all we want a complete, if not complete, at least near complete recovery of the patient.
Ma'am, like, is it true that mental mental activities like reading or maybe working through puzzles and all, does this stimulate the brain?
Yes, yes, it increases brain power. Reading, when you read a book physically, you hold a book, you turn the pages, you smell the book, and these every sensory cortex gets stimulated.
Okay.
They are the best activities. That's why whenever there are digital classes and all these are coming up, but do not throw away your physical books, because touching a book, turning the page, is everything is important to develop a good neural circuit.
Obviously, a patient when goes through this entire process, he or she in many cases would not be in a state to understand what's happening around, right? So family somewhere is obviously the backbone. So like, how can the family members motivate to improve or recover these kind of patients?
First thing is they should not panic and they should prioritize. These are two P's I tell them.
Okay.
That do not panic and prioritize patient's health. That is what should be done. Once you put that on priority, obviously you understand I have to, what happens. I'll give you an example in this. Sometimes, no, I have seen children are staying out of city, Bhubaneswar se bahar reh rahe, Bangalore mein they are working or something. The question they'll ask, कब तक ठीक होंगे? When can I go back and join my job?
Right.
I understand, because that is totally required, because how otherwise they'll sustain the families. But then you understand the patient, if person is having stroke, one side is not working, or if patient is in a phasic condition where he is not understanding, they require a full-time support.
Right.
In
So
such cases, that's why I say prioritize, do not panic and prioritize the patient's health. Then only we can go hand in hand and achieve something good for the patient in a longer run.
last but not the least, I would like to um, know from you, or rather, I would request you to help us with few lines like which will help these families of those patients who are ailing or who have been through this. So, how can they motivate their own patients and keep themselves motivated during their entire recovery process?
Yeah, caregiver has to take care of himself first, because if they are panicking, they are worried, then the care gets limited in some way or the other. So they have to work on their own mental health, be calm and like understand what is happening, and get the facts checked from a authentic source, not like anywhere else, and going to a authentic source and getting the facts checked, everything is important. That is a background. Second is, if the patient has suffered a stroke, traumatic brain injury, or spinal cord injury, or something like that, then the amount of deficit or deformity whichever has set in is not a permanent thing. That positive attitude has to be there. They have to work on that, so that deformity's effect gets minimized. For that, they have to have a holistic approach. Apart from medication, physical therapy should be given equal importance, and joining a holistic rehab program can be a good support system for these kind of people. And I think that is the only way forward. We have to bank on the neural plasticity and believe that something good will happen. We can reform, rewire, and relearn the skills which we lost, or the new skills if it is required in that patient. So I think we have to be positive and believe in the neural plasticity in a big way.
I would really like to thank you for explaining this entire thing in such a simpler way so that people, those who do not have an idea of that these things are actually recoverable. So I'm sure this will be helpful for them.
Yeah, it's
Yeah.
true, because it's just we have to think that it's a new road we have to make. There was one road which got blocked, like हमारी सरकार नया सड़क बनाती है गांव तक पहुंचने के लिए,
जी।
वैसे ही हम लोग को हमारा ब्रेन में नए रास्ते खोलने हैं, नए तरीके से उसी काम को सीखना है, और उसके साथ हमको जीना भी सीखना है, पॉजिटिव भी रहना है.
Right. Ma'am, thank you so much for explaining brain plasticity in such simple way.
Thank you.
Thank you. Thank you so much. Thank you.